Welcome back to the side of the show. That was our package, like we do it every day, Monday to Thursday, unless on Friday when we bring you entertainment news. Now we're about to begin our discussion today on health. If you're not aware, the federal government has given public hospitals 50% subsidy on electricity used. Apart from that, we have information that Nigeria has received 10,000 Mpox vaccines in the country. Recall the WHO had declared Mpox a global situation, and of course the DRC and the eastern part of Africa happen to be the highest or majority infected in Africa as a whole. Of course, Nigeria has its statistics because we have information also that we have Mpox in the country. The reason why often if you listen to our news, we now have an Mpox update on our news right here from Ondo City. Now, we have our doctor in the house today to help us understand health sector relief, federal government 50% electricity subsidy, and 10,000 Mpox vaccine. The analysis this morning is with Dr. Olubusayo Modupe, is a medical practitioner, is the Director of Health Insurance Schemes, State Specialist Hospital Ondo, as well as Project Coordinator, HIV Program, also State Specialist Hospital, all in Ondo City. He is our in-house doctor looking this morning. It's so nice to have you on Daybreak Africa.
It's my pleasure.
No, when I see something good, I have to mention it. Doctor, you're looking like new money this morning. Ezekiel, the doctor is
teasing.
In fact, I look like the odd person because if you look at Ezekiel is looking like someone out of, in fact, I don't know what to say, out of a GQ magazine this early morning. I appreciate what you guys are wearing. But let us begin our discuss. Two this morning, which is the 50% and of course the Mpox. But before we delve into the situation, Nigeria is the largest black nation in the world. Nigeria is the most populous nation in the whole of Africa. Yeah. We are about 200 million people, and by say 2030, we're expected to like double or triple that number. I want to ask, as a medical practitioner, with that number, how would you say our health sector is faring to care for this number? And directly or indirectly, how would you rate the Nigerian government in caring for its people with a view at the health sector? You have to give us your opinion, because that smile, I don't know, moments like this, I want to speak pidgin English, but I don't know. Anyway, we really want to start on that note. Take a look, an overview of the health sector, and of course, let's bring into play the number of the people in the country right now.
Well, the estimate is 200. We don't even know our population. When last was census carried out in Nigeria? I think last year there was supposed to be another one. Something happened. Up till now, nothing has been done. So we don't even know. But we estimate we are around that. Is the health sector serving the population? No. Because the human resources for health from all cadres are grossly inadequate. What about supplies? Well, even if the supplies are there, I'm talking about drugs now. Can the citizen afford it? Most of our citizens cannot. So we are not doing well there. What about the equipment? Are equipments up to date? Are they even readily available? The answer is still poor. And so the health sector currently is not able to serve our population. Simple.
Okay, what about the 4-point agenda, the Tinubu's administration 4-point agenda for health? One would expect that because when he came in with an agenda for Nigerians, and health was one of them. And Nigerians will really want to know, as a follow-up with that type of analysis, how we are faring in terms of the plan that the Tinubu government has for the health sector, even before we talk about the 50% subsidy so far.
I'm not sure, except I've not seen the effects. Or let me put it like that. I'm not sure I've seen any improvement in the
renewed hope agenda.
Yes, as regards health. I'm not sure I've seen any.
Just before Ezekiel comes in, the renewed hope agenda says the federal government plans to improve quality of governance and leadership of hospitals, appraise leadership of tertiary hospitals and teaching hospitals, strengthen the regulatory capacity of institutions like NAFDAC, work to improve regulatory functions at the supply chain level. Of course, from your analysis, supply in terms of medicine and of course equipment, there's still a dearth in that aspect. Yeah. So I know Ezekiel is gearing to go, but we're laying the foundation for our discourse this morning. And our doctor has rightly said, for one who is in the system, that we are yet to get that renewed hope agenda running in terms of health for Nigerians. Ezekiel.
Well, personally for me, I would like to stay away from the renewed agenda stuff. I want to talk about things we actually tend to confront at this moment, the situation at hand. Doctor, I would like it if you give us first-hand information as to the current situation of Mpox cases in Nigeria. How many confirmed cases? What are you guys doing about it? What is going on currently? I mean, it's better to have a first-hand information from professional in that field.
I think we're in the EP 34 weeks. My last check, that's for this last week. There's no new record now.
Okay.
I think there were just 8 confirmed cases. I think 50-something suspected. But I know we just have 8 for a week. That's this last week, up to 28th August. That's the last record. And all over we know that I think 20 states with FCT at least have had a case. In the southwest, I think Lagos, Oyo, we don't have in Ondo State yet. I'm not sure we have in Ekiti, but I know we have in Edo now, because I just looked at the statistics where the states near. Yeah.
So we're talking vaccines. You want to do a follow-up? We're talking vaccines. I remember the last time you were here, that was like when the Mpox started, more or less, when we actually needed to create that awareness for Nigerians. We went out to town, went out to ask Ondo residents or Nigerian citizens living in Ondo State if they knew anything about the Mpox. We were shocked to discover that Nigerians don't even know anything about it, so we had to quickly create that awareness. And I remembered Ezekiel asking that about vaccines, if we have vaccines to tackle. And suddenly we now hear that the USAID has given Nigeria 10,000 pieces, to be used. We want to find out from you. The question Ezekiel asked was, why do we always wait? And you answered, Nigerians are rather reactive rather than proactive. Yeah. In your own opinion, we want you to give us an analysis of the situation, Nigerians waiting cap in hand to receive vaccines. We finally received the vaccines. What is the reaction? Because we know definitely that Nigerians shy away from taking vaccines, as it were. So we don't know if you have any information you can give to us with the inoculation and, the process thus far.
No, naturally when it comes like that, it's national. Then from there, it will be distributed to states. That's the normal line. There's a primary health care development agency. There's national, and every state has one too. So once it comes like that, anything that has to do with immunization is through them. Then it goes to the states from there. Now, the truth of the matter is, let's talk about numbers. If we were giving 10,000
vaccines
for around 200 million people.
For 200 million, and everyone is supposed to take 2 doses.
That's a complete dose.
Yes. And so that means technically we have like 5,000. Where are we going to start from? Now, probably the other thing we need to know about Mpox vaccination is it's not given to everybody. So we don't expect
everybody to take it.
Yes. There are some people who it is advised that they have the vaccine. One, that would be close contacts of those that have Mpox. Remember when we were talking about how it's transmitted, close contacts, closeness, even sexual closeness is part of it. Any group in that, anybody in that group should be vaccinated. 2, there are some people who are at risk, high risk people. 1 is the commercial sex workers. Because they have contact with a lot of people
from all parts.
Yes. And unfortunately, the condom will not protect.
Okay.
Yeah. Then those children, especially less than 8 years. In fact, if you look at the demography of those affected, the commonest age group affected in Nigeria, they are the children, less than 5. After that, the next demography is like 21 to 40. These are the groups that are active now. Very active, moves about. And so, young, they can have. Then, of course, health workers. We see a lot of people. You don't even know what they are going through. Then, of course, those with immunosuppression, those whose immunity is low, because they are at risk. Of course, including people with HIV, especially those whose viral load is not suppressed.
Okay.
Because if the viral load is suppressed, what I'm trying to emphasize that is that it's not all HIV patients. It's really those whose immunity is poor, but those whose viral load is suppressed, they are virtually normal.
Okay.
So their immunity is strong.
Okay.
There are also some people who are on drugs that reduces their immunity, like steroid. For example, those who have had a transplant, they are on long-term
Steroids.
which can also reduce immunity. These are the groups that should have immunization,
Okay.
the vaccine. But the truth of the matter, reading through this group, how many will 5,000
Cater for
in Nigeria?
It's safe to say we have no vaccines then.
What?
It's safe to say we have no vaccines in Nigeria then.
Because now, how many will be distributed to the states? Are we only giving the 20 states an FCT with cases? I'm asking. That it's not in Ondo State today. I look, how often do people come from Lagos to Ondo State? Very often. It's in Edo. I think 2 weeks ago, I was in Edo State. People move from Edo State to Ondo State regularly. You know, if you are familiar with Ondo State, Edo, from Ondo Ore, by the time you move down, you're already in Edo State. So I don't know how that vaccines will be distributed. I'm even confused.
Now, apart from the fact that we don't have enough vaccines, there's even vaccine hesitancy among Nigerians, which I mentioned earlier. Let's assume that suddenly USAID or some other organization brings free vaccines to Nigeria. How do you even get it across? Because we're talking about misinformation. We still have misinformation in terms of the Mpox and even vaccines, or no information at all. So let us talk about disinformation. Yeah. So how do we tackle that in terms of Mpox?
The first thing is this, it's another thing about vaccines. Vaccines on its own, there are a lot of information, a lot of misinformation, a lot of disinformation about vaccines generally. That probably they want to sterilize people. There are a lot of. I remember when the HPV
program was rolled out.
Yes, it was the same thing. So we need to continually. I decided to pick the vaccine first before going to Mpox. The government, you see, I think one of the major challenges, and is the same thing affecting even Mpox, is that most citizens, they have lost trust in the government. They don't even believe what they are saying. That's about when diseases comes, when there are outbreaks. Is it true? So a lot of people will opt for seeing is believing. Seeing is believing. Okay, I can see someone. So there's a trust issue. I remember when COVID-19 came, it was the same thing. The government, people, it's a lie. People are just, because there has always been that trust issue. And so once that happens, you don't even believe what the government is saying. And so that's why it's important for health workers, for media houses, to continually drum this information You know, when you were introducing on your news, there's something on Mpox there, updates. At least, if, for example, all stations doing the same thing, you know, even I'm not sure KAFTAN TV is a government. I know it's even not government.
It's
you know,
not.
if it's only, I know, if it's government now, you probably say it's government propaganda, but it's not government station. And so things coming out from this kind of station will help and people to recognize that
There's something going on.
Something going on. So we should not allow it to. We should not be discouraged. The truth of the matter is that once there is disinformation and misinformation, it's so difficult to break it. And so, but by continual passing the right information, then there will be behavioral change. Once there's behavioral change, and the same principle for the vaccines. How many people have been vaccinated that died? You know, all these things we need to continually talk about it so that our citizens know that.
You know, Anire did mention the fact where when you ask people on the street here in Ondo about employees, tell you what? And you did mention misinformation and disinformation. I'm curious.
Even so, then the other thing is this. Even I still maintain, apart from even wrong information going out, that's the meaning of misinformation and disinformation. Somebody can just wake up and just to cause harm, just post anything against Mpox. You are not sure of it, you are distributing. So that's disinformation and misinformation. But even as we got Mpox, apart from that, and once there is vacuum, all this we try. How many people go online and check and see DC
updates? But what is the role of the federal government? Because again, I remember that when you came here, we talked about the role of the federal government in disseminating information concerning the Mpox.
So they are not doing anything. That's where. So in fact, there is a vacuum. So there's no information coming out. That's just the truth. From state and from federal to state, we had the sponsored adverts on Mpox.
Billboards.
We had the billboards.
Newspapers.
Nothing.
Social media.
Nothing. And so, there's disinformation, there's misinformation, there's the major problem, there's even no information.
Nobody. Coming to that point, I was wondering if patients come and they are well informed. Are people informed? How well is the government really responding? Is it that it's more like the best we did was to request for a vaccine, 5,000 vaccine and all that? Is that all we did all this while?
Yes, NCDC is doing its job, doing the scientific, all these things. But other ministry, other agencies, there's an agency that is supposed to be informing people under Ministry of Information. I can't remember the name now. What are they doing? What is the Ministry of Information doing? What is Ministry of Health doing? Yesterday in the hospital, a patient was to see me after seeing another doctor. Came with face mask. because saw the doctor in the general patient, and that's where everybody will come in. So if there is monkeypox, you are going to come in there. So, and because I talked about droplets. You know what? When the patient now came to me, he said, you are with face mask. Thank God. He said, don't mind the doctor. The doctors refuse to see us at the other side. They just want the people, before you come in, to put on face mask. Apart from hand washing, that's a very simple way of preventing, because
of the
droplets. But to that patient I saw after, GOPD was trying to be difficult.
Trying to be funny.
Yes, not difficult. Just wanted to make sure they buy no information.
No information.
No information.
Now, technically, whenever there is little or no information about a particular challenge or a situation, it simply means it's not really a big of a deal. Could that be the case? Maybe it's a big of a deal somewhere in Congo, somewhere abroad, but maybe in Nigeria. Let's just say the government has it all under control, so they need not raise the mind of the people anymore, just, make them worry less or make us worry less.
Do you know, if WHO declared a disease
global
as something of global importance, WHO must have seen something. That was how COVID-19 started.
Can we really equate this to COVID-19?
No, I'm not equating, but an outbreak is an outbreak. It does not kill like COVID-19. But to a family that lost someone, that's 100%. To a family that lost someone, even if there's only one death from it, to that family, who knows, that could be the breadwinner of the family. To that family, that's 100%. And so, if WHO, with all their study, with all their networks, do you know the Mpox scene in Europe is not linked to Africa at all?
It's not?
It's not. If it was probably somebody traveled
from here.
Yeah. No. So that means this. That's why it has been on for quite some time, but it was not of global importance. Yes, that means it's
within Africa.
Africa. Most commonly Central African countries. But now, no link, getting outside to Sweden, all these places, then there's something that is important.
Doctor, I want to build on what Ezekiel said. The fact that probably the Nigerian government is not making a fuss about it because they don't want to create a panic. And suddenly you now said something, because while I was researching, I never got this information. So we have three situations. Before now, Mpox was an African issue. Yeah. Then suddenly we woke up one morning, there's a new strain, never seen before. Yeah. Then suddenly outside the shores of Africa, we started having occurrences here and there. Yeah. That's a third situation. And now what is happening outside the shores of the country, of Africa, the continent, has nothing to do with what is happening here.
Yes.
So on that basis, how do we begin to let Nigerians know how important, not just the government, but citizens, of how important using these three basic information to educate them?
It's so simple. Your station, you are doing well. In all the dialects. I know there's KAFTAN Yoruba.
Yes, we take the news in Yoruba
Yeah,
too.
yeah.
Yes.
There's KAFTAN
Hausa.
I don't know if there's KAFTAN Igbo.
We're working on it.
Are you getting my point? At least all this information, simple thing, how the symptoms, how one can get it, how you prevent yourself. Simple information that you don't need to be a professor to understand the simple information. We need to continually bring out this information. Then updating this kind of updates, okay, deferring to what is happening even outside the people come in regularly from other states, from other African countries, and even from outside the continent. So just one person just needs to bring in. When Ebola came to Nigeria, it was brought by a Liberian.
And somebody paid the price to ensure that we're
it
not
was
wiped out.
Only one person.
We'll take a short break. When we return, the conversation will continue. Stay with us. Welcome back. You're still watching Daybreak Africa. That was Go Start. Please ensure you run with every information you got right there on Go Start. So you can start and wherever you are with little that you have to ensure that you're financially stable beyond the little that comes from the salary. Before the break, we were taking a look at our Mpox situation, not just in Nigeria, but of course the information from across the world. But now we're going straight on to the other part of our discourse today, which is the 50% electricity subsidy given to public hospitals by the federal government of Nigeria. We have our doctor here, and we want to ask if this would make a difference.
Yes, as regard costs, overhead costs, that will make a difference. Because energy is so important in the hospitals. You have patients on the wards, you want to put them in darkness. Virtually all the equipment uses energy, electricity. X-rays, CT scans, MRI, everyone uses electricity. In the theater, for surgery, you need power. And so, with my closeness to management of hospitals, I know a huge chunk of money generated by the hospitals goes to power. Power holding, no matter where the power distribution, you know, there are many, depending on the state.
Yes.
And of course, to diesel. Major chunk. And so, with that reduction, then that means about half of the overhead spent on power generation has been reduced. So that means the hospital management will be able to use the saved fund for other things.
Doctor, just to take us back just a little bit, not to hold our train of thought on subsidy. We're just thinking, you did mention everything, but except for testing kits. Do we have available testing kits? And should we be confident at the point where we could have free testing centers for Mpox?
Sorry, Ezekiel, I'm sorry.
Yes.
Since we've already started on this, when we're rounding up, we can now refer to
all right.
Not vex,
Wow.
yeah.
No problem.
Okay. So do you have any question for these electricity things?
Yes.
You and this Mpox today.
No, my head does go back because
I'll remind you. Okay. So you want to ask a follow-up question?
Yes.
On electricity, okay.
Yes. I remember the last time you came in, we did mention some of the inadequacy we had in our health sector. So I think at this point, would this subsidy tend to, affect the operations and other healthcare facilities?
No, the management would be able the saved money will be able to probably use it for some other thing. But that will not solve the issue of human resources, which is major. Human resources, either state or federal or local government, are paid by the government, not the hospital. But simple maintenance carried out by the hospital. And the major challenge we have in the health sector is human resources for it.
Has simple maintenance ever been a problem? I mean, that has always been an issue that has always been sorted out. So if this a 50% electricity subsidy really doesn't change a major
you think
factor.
maintenance? No. There are gigantic instrument equipment in the hospitals. For example, the X-ray of a machine of an hospital is spoiled, and the biomedical engineer came. The tube, what is causing problem? It's true life. It's 1.5 million. No, that's massive. I'm just mentioning
One equipment.
One equipment. I'm not talking about CT scan that will run into millions of naira
For maintenance.
Because if there's a challenge for the next 6 months, because the truth is the money is massive. And there are no equipment or instrument that you just abandon and go and probably buy another one. It's not as easy as that.
And it's a hospital that maintains all that maintenance, not the federal government for federal government hospitals.
Purchases, even for states, but most of the purchases can be from government.
I just want to be sure I'm not putting words in your mouth, Doctor. Yeah. In essence, what you're trying to say is the 50% subsidy is a good improvement, but has no major effect so far.
Because the main challenge is human resources for health.
For health.
There's nothing that will not change anything. That will not make me, don't quote me, leave the country tomorrow.
Okay.
There's no direct effect on me. That will not make my colleagues that have traveled out to return back home. That will not.
So that is, if the boat is rocking, there seems to be no stability.
Yeah.
The wind is still blowing, and there is no hope of,
the hospital can run better. But even if the hospital is running better, who are those to use the instruments? Who are those to use the equipment?
Now, let's talk about what happened in Lagos. That is Akoka, where the hospital was cut off the grid because they were owing. That was before the subsidy itself happened, because they were owing some money. And while I was doing my research, I discovered that Akoka, that's the university, pays as much as 150 to 180 million naira for electricity. Again, the hospitals are put on band A. Then we have to place the 50% subsidy on the side. So I'm just wondering, with the hospitals being placed on band A, then the subsidy coming, is it like the more you look, the less you see kind of situation? And for hospitals to pay as much as 180 million, I don't know what other hospitals pay, but that's what researchers said. I don't have the statistics. I didn't do the investigation. I just Googled it. So the 50%, how does it come in here to give any respite or reprieve?
No. If, for example, if all hospitals are on band A, then they should have almost 22 hours
electricity supply.
Electricity. That will drastically reduce their dependence on what's it
diesel.
Called? On diesel. No, diesel is on another
level.
That means the main expenditure for power generation, it's from the national grid. And so if you now have 50%, to me, that's a very good development. But on the assumption that they have nothing less than 22 hours
power supply.
But if you are having a lot less than that, and which is, very often the national grid collapse, it's now a normal thing than abnormal thing. You just see the grid has collapsed again. And once it's collapsed, it takes almost 2 days thereabout before
there's restoration.
Everything get restored. If the power from national grid is less, that means the hospitals still depend, we still use generator. Very pathetic. This is a true life story. We lost somebody in an hospital. Accident victim. When was rushed to the hospital, there was no light. There was no light. Eventually, we lost the person.
All because of that incident?
No, it's so simple. There's no light. There's no
diesel.
No, from national grid. It's either they are minimizing expenses on diesel. Because I'm aware this hospital pays very huge amount monthly.
On diesel?
No, even on power.
On power itself.
And also on diesel. So I think they were trying to cut the expenses on diesel.
And that happened?
That happened.
Now let me
that man
would have been alive. Now let me add to what the doctor said. We've had I've had 3 situations in my life where power was a problem, and this is the truth. 2 of my sisters and a friend. My sister, a general hospital. You better believe me, I have my facts. If you come to investigate, the child is still alive, my sister is still alive, her husband is alive. My sister went to have a baby. We were told she had to do a cesarean, and she was told in the general hospital that there's no diesel. I'm talking about almost 20-something years ago. And the husband had to get diesel 20-something years ago for a general hospital because he needed to operate on my sister. Then another one, my sister went to a hospital, a private hospital, to give birth, and they were told, look, the generator is faulty. We have to repair the generator because It looks like the baby had umbilical, cord round. It was a serious, she was not dilating, she was dilating, but there was a problem. So we had to go get a repairer for the generator and get diesel. But fortunately for us, what happened was immediately we did that, they brought the light. Then I had a friend in Port Harcourt who went into labor. There was no diesel, there was no light, so they had to use lamp and torch, yes, to do the operation. And for 17 years she was barren without a child, and they spent millions, because that singular act made the doctor make a mistake. The doctor went into trouble. They became a court case because something happened to my friend, and for 17 years she didn't have a child. It took South Africa, it took surrogacy, it took a lot for a child, millions for a child to come. So this is very, very important, and we know how important it is to the health sector. Again, let us take a look at challenges beyond electricity in this sector. I know there are some issues in your heart that you would want to pour out. Beside electricity, beside power, let us know some of the, beside human resources, what other challenges do you think needs to be addressed, not just by the federal government, but of course we know that we have private partners in this journey. What other issues can we say bedevils this industry?
And we also need to look at investigations. Our labs, our radiological department having what they are supposed to have. For our pharmacy in the hospitals, having the drugs, even if they have it, are the drugs affordable? How much is a Ventolin in Ela now? Salbutamol in Ela for asthmatic. How much is Seretide inhaler for asthmatic? How much is faithful augmentin? Those are almost getting out of reach of citizens. We will count the number of hospitals that stock because they are now so expensive. Because if you stock it, I'm not sure it can expire in the store.
Because citizens can afford it.
Cannot.
This is serious.
What happened? The company producing it in Nigeria left Nigeria.
So the price went off the roof.
No, that means it's imported back to Nigeria. There's no production there. And the truth of the matter is, the simplest for asthmatics, the simplest inhaler, you don't need to be a doctor, everybody knows. Ventolin. That used to be less than 2,000. It's not something you can just dabble into now.
Wow. That's serious.
Doctor, to be honest, I'm quite cold right now. But I think every now and then we hear the federal government talk about investments in health sector, massive investment. Is it safe to say at this point, with the most current development, saying they tend to probably invest massively in minor things and keep away or shy away from the major things. And at the same time, I want to ask, it's indeed good for the 50% subsidy on electricity,
it will have some effects,
but let's talk about the reliability. How reliable is this sector, the electricity sector, in correlation with the health sector? Can we really rely on them, be at a point where we could actually stay away from diesel, stay away from solar or any other power, and then depend on electricity grid, just it alone?
You cannot depend on. I said, commonly, we have national, what do they call it now?
The grid.
The grid collapse, yes. So you cannot. I think some of the hospitals should start to consider should be alternate power supply. Alternate power supply.
Even with the current development of 50% subsidy.
How long will that take? Remember, the government is removing subsidy on everything. I know it will just be for a period. Is the government going to pay the distribution company? Are they going to pay them? So I don't understand.
How feasible?
I don't know how they are going to do it. You have distributed, you are giving from the transmission company to the distribution company. They must have paid something to have that. Is the distribution company that is not distributing to hospitals, to our homes, to the station here? When they add that, the government have reduced what they have paid? How are we going to track how much the hospital will be giving? Remember, the issue of fuel subsidy, one of the challenges they said we have is that they are not able to track that people will bring in fuel as subsidized fuel for, they take it to other places. That's one of the challenges. So how are we going to? Is a system already in place to track that these hospitals are given what they are supposed to be giving, and it is 50% that they will pay? Who is paying the other 50%?
Okay, I know definitely I think you just gave us a topic. Who will pay the next 50% will be a topic on health that we'll talk about. Time is not our friend. Yes, I know we say that often, but it's the truth if you're watching the show. This is where we call it a day on our discussion on Daybreak Africa today. But we need to thank our doctor for coming on the show and always, be getting themselves available to, discuss issues. We appreciate you.
Thank you
once again. My name is Anire Binitie. Stay safe and bye for now.
Have a great day ahead. I remain Ezekiel, Ogar.
Yes, there is news on your device, but hearing an analyst's perspective is the icing on the cake that Daybreak Africa provides. Break. Start your day with prompt analysis of the latest news, trends,
exactly, and then you see these people, they're so agile, they can do a lot of
politics.
We have to go back to that regional system. That is the foundation of this country, for God's sake.
Entertainment, fashion, culinary skills.
So first I'm going to be pouring the oil inside the pot.
Religious and cultural events amongst others on Daybreak Africa.
For a rich mix of analysis on current issues, tune in daily from 7 a.m. to 9 a.m. on channel 480 and 124 on Startimes.